Good afternoon, and welcome to the Rotary Club of Madison. I'm Teresa Holmes, Club President. Thank you, everyone, for joining us. Today's meeting is sponsored by Jim Ruley, and our thanks to Jim in his support of our luncheon today. Opening music, we will start our opening music today by listening to the national anthem led by both Angela and Jeff Bartell. Immediately following the music, our guest will be introduced by Laura Gallagher.
Of course you won't listen. You're going to sing. Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare of bombs bursting in air gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave.
Good afternoon. I would like to welcome and ask everyone else to welcome our guest here today. And guests, if you would please stand when your name is introduced, and then we'll welcome you all together at the end. So Trenton Grant, a guest of Susan Schmitz. Chris Johnson, a guest of Teresa Holmes. Sadat Khan, a guest of Mike McKay. Ron Timmons, a guest of Lou Harned. Kelly Ruppel, a guest of Becky Steinhoff. Jennifer Johnson, a guest of Teresa Holmes. And Bill Pennell, who is from the Rotary Club in Wellington, Ontario. He has a banner, a club banner to exchange with Teresa. So Bill, if you would please come to Teresa's table. That's okay. And we'll do a quick, is there a photograph? Yes. For the exchange of flags. Welcome, everyone.
Thank you, Laura. Joyce Bromley, who chairs our Member Recognition Subcommittee, is here, and she is going to present an award to 6 of our club members. Joyce? I saw her in the room. Oh, there she is, yes.
Thank you, President Teresa. Each Wednesday, we come together to have lunch to connect, grow, and serve. Many of us don't realize the extent of details and logistics that occur to make this all happen. We have 6 members who've played key roles in keeping us together this past year and a half, meeting unprecedented challenges due to the pandemic. Within 2 weeks of the time that we stopped meeting in person in March 2020, we were holding online meetings. The coordinated effort to make the transition was quite amazing. After months before new COVID prevention guidelines allowed us to transition, President George and many of the program speakers could appear live from Pearson Engineering. During the time of the crisis, our club leaders took a deep look at the many club critical issues and worked out a plan to make our club stronger in the future. We owe a great deal of gratitude to the board of directors and other members involved in this transition. Club leaders reviewed our dues and meal structure, created 3 task forces to develop recommendations for membership recruitment and retention, and developed recommendations for a new governance schedule. Today, we will recognize 6 members who Renee Moe in her Membership Recognition Committee identified as playing key roles in making these changes. The board approved their recommendations for the Rotary Club of Madison Service Awards in recognition of their leadership through these challenging times. I will ask the following members to come forward individually as I call their names to receive a certificate and pin from President Teresa. Then, as a group, please stand down in front of the podium and we'll recognize all of you at one time. The following 3 members are receiving Community Service Awards. We will begin with ANDREA KAMINSKI. Here she is, okay. Who as president in 2019 and 2020 began the effort of making our transition to online meetings. She recorded at home on her cell phone from which she was moving, and then from her new home. Her videos were pieced together with announcements and with our speakers' video to create a cohesive online meeting each week. Next is George Hidalgo. Here he is. Our president last year, who built on the efforts started by ANDREA. George dedicated a great deal of time preparing and recording the videos and eventually transitioned to our live streamed meetings, making them as interactive as possible. He also led the club board through major changes with the new dues structure and working with the task force as they brought forward their recommendations for approval. And let us not forget, he met the push-up challenge. Brian Baskin, shown on the screen because he is unable to attend today. Brian turned his conference room at Pearson Engineering into the Rotary live streaming studio. It was quite a sight to behold. He helped us determine the necessary equipment required and provided hundreds of hours of AV support, editing videos and helping with the live streaming. Even before the pandemic, he had helped run our meetings and continued in that role now that we are back at the Park Hotel. Additionally, we have 3 Club Service Award recipients to recognize. Past President Jason Barron also provided hundreds of hours setting up the equipment for our live stream meetings and helped us run the equipment. He patiently worked with the inexperienced speakers and their many retakes and retakes and retakes. As a past president, Jason offered good insight into helping with the transition to virtual meetings and the formatting. He too continues to help record meetings now that we are back in person so that members who are unable to attend our in-person meetings are able to review them and read them and watch them on YouTube, on our YouTube channel. Neil Fauerbach took individual videos sent in by our musicians and edited them. He created those terrific finished music videos that entertained us at our online meetings. The editing takes a lot of time and effort, and we appreciate all that Neil did behind the scenes to make it happen. As well, Neil served as chair of the program committee for the past 2 years. We are grateful for his leadership in selecting timely speakers, even while we were meeting virtually. Last but not least, Mark Moody, who invested many hours in working on dues restructuring and our new governance plan. He developed 5 teams of committees and reduced the number of committees from 40 to 25. This new structure makes our committee more cohesive, and the team approach will make us more efficient and will provide better communication. We appreciate Mark's dedication to moving our club forward. These 6 members whom we recognize today are shining examples of Rotarians who have dedicated themselves to serving Rotary and the community. They have gone above and beyond to keep our club strong. Let us thank them for their service above self.
Thank you, Joyce. And thank you to these Rotarians. I would like to mention that today is Mark Moody's last day with us. Ooh. He and his wife are moving to Florida next week, and he just told me that they're going to be doing a little bit of some tripping. We'll call it that. And so we hope Mark does come back to visit us when he's here in Madison on occasion. So best wishes to you, Mark, and your family. And thank you again for your service to our Rotary Club. Steve Goldberg chairs this year's Manfred Swarzinski Humanitarian Service Award Subcommittee, and he also has an announcement.
Thanks for holding your applause. Good afternoon, and thank you. So, fellow Rotarians, I want to give you a little bit of history. In 1982, this club established the Manfred Swarzinski Humanitarian Service Award to honor a man who had become a local and global role model for humanitarian service and was a longtime active member of this club. He was also my rabbi, Rabbi Manfred Swarzinski. And I got to know him pretty well at the impressionable age of 11, 12, 13, 14, and so on, and later in life as well. The award recognizes individuals who, by their community and volunteer efforts, make a significant contribution to humanitarian service in the Madison community. The award includes not just the honor itself, but also a $2,500 gift from the Madison Rotary Foundation to be designated to the nonprofit organization of the recipient's choice. Recent recipients include such people as Dr. Floyd Rose, Masood Akbar, Melanie Ramey, Jonathan Gramling, Maleli Shikasa Anana, to name a few. This year's recognition will go to somebody nominated by people in this club. It can be a club member whom you nominate, or it could be anybody from the community whose approach to humanitarian service you admire and respect. The nominations are due October 1, and you can see and pick up nomination forms on the table as you leave the meeting today, or go online to the club's website and you'll find the form there. I look forward to giving you more information about the award and about Rabbi Swarzinski over the next several weeks. And I especially look forward to the club luncheon in November, when we will, as a club, recognize this year's award recipient. So I thank you in advance for your help in identifying worthy recipients of the Manfred Swarzinski Humanitarian Service Award, honoring a man who truly led a life of service above self. So thank you.
Thank you, Steve. I think it'll mean a bit more personal and have a bit of a more connection this year since Steve knew him personally, so that'll be great. All right, so Rotarians, you know that I am continuing my traveling with Teresa series, where I basically go out into the community to bring a bit more visibility to our Rotary Club, and where I'm actually sharing information about our club within the community. So earlier this month at our Concerts on the Square event, I met a few other people in the community, and so I want you to watch this video. So I'm meeting people on the street tonight at the Concerts on the Square, asking them if they know anything or even a little bit about Rotary Club of Madison. You're your representative, right? As president, you should be doing something, right? And then we're inviting them to lunch. So any of you would like to be my guests at our table? You're the owner. Are you the owner?
Yes.
Yeah, you're the owner. I've spotted you. What's your name?
He's the owner.
To meet you.
Kinda. Our world is.
The job that is free, I bring joy to people. So I love that you're smiling. Yeah. Well, I'm not too invasive, so that's good. That's good. So what's your name? Andy, I'd love to invite you to lunch.
All right.
So guess what? I'm not going to make you
Remember, Andy, there's no
uncomfortable.
such thing as a free lunch.
All you have to do is come to lunch. So when I call you, you accept my phone call, or at least return my phone call, and let me get you on the calendar, and just come and enjoy one of our programs. When we invite the guests that I met on the street, we show the video, the small video segment. They tell me it has to be less than a minute. I don't know about that because I love to talk, so I don't know how we're going to get it whittled down to a minute. But by permission, we ask the guests if we can show it really much. How about that? Sound harmless?
Yeah.
All right. I'm glad I stopped at this table. And this lady. All right. So Chris Johnson, who was one of the people that I stopped at one of the corporate tables, is in the room with us today. Chris, would you please stand? Chris is the owner and president of Johnson's Sausage and Retail Shop. And so, Chris, thank you so much for attending our meeting today, and I'm looking forward to being able to tell you more about Rotary. And so, Rotarians, if you, I actually am having fun with these videos, and so I would like and welcome your suggestions for creative ways to make them more fun. And Neil, I want to thank you, Neil FAUERBACH, for your assistance in helping me with the edits on the video. Birthdays. We have birthdays to celebrate with a bit of humor and wisdom to complement Rotary's mission. We encourage our members to make an age-appropriate gift to the Madison Rotary Foundation, rounded up to $100 for our club's Synergy Scholarship Fund. Rotarians, if you're in the room, please stand. August 22nd, Steve Holzhauer, who says, "I am sincerely grateful for my friends and fellowship provided by the club. Thank you." August 23rd, past President ANDREA KAMINSKI. August 23rd, Paul Olson. August 24th, Kevin Hoffman. Our thanks to our celebrants for their contributions to the Madison Rotary Foundation. Please join me in wishing them a happy birthday. All right, just a quick reminder that now with the new Dane County Public Health Order, we are required to wear a mask during our meetings, and so this is expected to be at least until September 16th, and we will keep you updated with any changes. Members in the news, Joe Loannis was pictured and quoted in an article last week titled, "In Tune with the New Normal, Madison musicians, ensembles, and venues tentatively return to live performances, hopeful and grateful, but changed." That was Madison Magazine on September 21st. And Jason Ilstrup was interviewed by Channel 3 News about a new program which will allow more Black, Indigenous, and people of color-owned businesses to open shops on State Street. That was on August 6th. Now, on to our program. Today's program is the last in our three-part series of a focus on rural broadband in Wisconsin. We've previously heard about the economics and the bridging of the digital divide of rural schools and libraries. Today's speaker will focus his attention on telehealth, or as he puts it, the return of the house call. As we all know it, it was only a short time ago where the term telehealth wasn't commonly understood and usually led to confused looks. But since the beginning of the pandemic, nearly 50% of the population has had a telehealth visit, compared to 10% prior to its start. Our speaker today is Chris Meyer, who will answer several questions many of us have. Once the public health emergency ends, what does it mean for the future of healthcare delivery and consumption? What new technologies might our doctors be offering us, and what can we do to ensure Wisconsin isn't left behind? Chris Meyer ponders these questions every day in his role as the Director of Virtual Care at Marshfield Clinic Health System, an integrated health system located in Marshfield. Chris also served as the mayor of the city of Marshfield from 2008 until 2018, long term, yes, and continues to be involved in civic activities in and around Marshfield. We look forward to your presentation, Chris, and we have made a contribution to the Rotary International Polio Plus Fund as a way to say thank you for speaking to us today. I also want to mention that if you have questions, our speaker at the end, that you would please allow time for the microphone to come and for you to ask your question. Let us welcome Chris to the podium.
This is the first time I presented in front of a group of people that aren't my dogs since February of 2020. So apologies if I'm a little rusty here, but as introduced, my name is Chris Meyer. I am the Director of Virtual Care and Telehealth for Marshfield Clinic Health System. Next slide, please. Oh, how's that? All right. Next slide, please. Oh, I just asked for that. See, I told you I'd be a little rusty. So I want to start today by talking about mission, vision, and values. For anybody who works in a large organization, you undoubtedly have a mission, vision, and value statement. And this is the mission, vision, and values for Marshfield Clinic Health System. In a nutshell, our mission is that we enrich the lives of those we serve. Our vision is where we want to go, and we're going to use innovation to be the consumer's first choice for healthcare. And we're going to achieve that by following our values. Mission, vision, and values sometimes get relegated to the boardroom wall. It's a nice plaque that you see, but this really tells us who we are as an organization and what we should be doing. Marshfield Clinic is an integrated health system. If you're not familiar with us, the little state of Wisconsin, that first block shows you our grade-in service area, including coming all the way down to Beaver Dam, with Beaver Dam Community Hospital joining our system just a few years ago. We have actually close to 1,500 providers now offering 92 different specialties of medicine, and we have a health plan with 200,000 member Security Health Plan of Wisconsin. We deliver our care into 9 hospitals, including a children's hospital, which I'll be talking about today, and we have a 10th hospital under construction in Stevens Point. So, as was stated when we had a great introduction here, I think I was told I was pondering things. I don't know about that. My wife would probably disagree that I ponder much. But as I looked at our telehealth volumes getting ready for today, our telehealth volumes are ramping up right now. And undoubtedly, it's because of the next round of COVID. In fact, in a little bit, I'm going to show you how our volumes very much match the waves of COVID that we saw. And then we're going to talk a little bit about what has changed, what needs to change to keep this new normal, and how we're going to, what types of technologies are going to be used in the future as you consume healthcare. So, I am an economist. I promise that the next 2 slides are graphs, and that's all you're going to see for graphs, I promise. These are important charts, though. This is a volume of our telehealth visits in Marshfield Clinic Health System from November of 2016 right to the end of 2019, so just before COVID set in. And you can see we had good sustained growth, growing from just under 1,000 visits per month in December of 2016 to 2,500 visits per month in November of 2019. The next slide shows the exact same data, but extends the time range out to June of this year. And you'll see what I call this the guess when COVID started spike. And there it is. So the same data, much flatter, but you can see the incredible growth of telehealth, growing from 2,500 visits per month to 23,000 visits per month in just 60 days. And as I said, you can see that was our first spike of COVID last March and April. And then over the summer we came down, we plateaued, and we had another peak in the fall. And while it's not as noticeable, the third little bump on that chart is the November-December surge we saw last year as well. Today, Marshfield Clinic announced that we are restricting visitors. We've grown from 2 patients throughout all of our system with COVID in inpatient beds the first week of July to 49 patients today. The surge is here. The charts very much match what we saw last March and April, and so we're anticipating similar types of patient volumes. Likewise, we would anticipate telehealth volumes to increase as people start to use more telehealth to avoid having to go into the clinic. That's the last slide with a graph, I promise. The data is really important, and that's what that graph shows us, the data. How many people, how much stuff, how much revenue did we get? But what really matters is how this impacts people. And we have to remember that last year when we shut down services, that meant chronic patients who needed to come in for their diabetes visit couldn't. And they had to figure out how to work with their doctor across the phone or via telehealth. And as a result, we saw a lot of patients with chronic illnesses start to have negative outcomes, meaning they were getting worse, not getting better or stable. And so throughout the pandemic, one of the things that we have done is tracked patient success stories. Telehealth is not a secret in Marshfield Clinic, and it hasn't been since the 1990s. We've used it to connect our facilities, to make our providers available to patients in our facilities across our service area. What was new with COVID was the ability to deliver that care directly into your home on your iPhone or your tablet. That was something we couldn't do prior to the pandemic. So we've had a couple of stories that have been published. I'm not going to read these all to you, but I'm going to talk about the last one because I think it's an incredible story. The first one, though, is my favorite title. It's actually an edited title from what was written on a patient satisfaction survey by a farmer. In central Wisconsin, no doubt we serve a lot of farms. We're one of the 7 homes to the National Farm Medicine Center. And on a patient satisfaction survey, I noticed a farmer in very colorful language say that he is seeing a behavioral health provider because, and I won't give a direct quote here, but there's no damn way I'm going into a building that says crazy people on it, sitting in front of a bunch of other nut jobs who might know me, waiting to go in to see my doctor. He's talking about stigma, right? We all know that there's stigma around the consumption of behavioral health services. And what we noticed was that we saw a lot of farmers consuming behavioral health services over the last year or so that hadn't before. So much so that we actually wrote a story that was published in the Journal of Agri-Medicine last September talking about this. Telehealth has removed some barriers to receiving care. Stigma, certainly one of them, but also travel. On that slide is one that I'm actually going to read it to you. It's not very long, but it's important, I think, to get all the details here. And this is a story about our children's hospital in Marshfield. And our children's hospital is connected to our main tertiary hospital in Marshfield. My children have been cared for there. It's an amazing facility. But this story underscores not just the great care that can be delivered in a hospital, but how that care can be extended via telehealth after an acute event. It all started on October 19th, 2019. Toddler Ashton Adams suffered a fall that led his mother to take him to the hospital. The family had no idea what would transpire over the next 6 months. He was a normal, healthy baby, said Martin, Ashton's father. He was just about to start walking and talking. One day when I was sleeping after working a night shift, my daughter came in and woke me up. She told me that Mom had taken Ashton to the hospital because he fell. During that ER visit, the doctors discovered a mass in his brain, Adams recalled. He was flown to Marshfield Children's Hospital for further testing. A few days after his admission, he had brain surgery. Ashton was diagnosed with ATRT, an extremely rare form of brain and spinal cord cancer. My son was in the hospital for 127 straight days, Adams said. My wife and I were there for the first 6 weeks, and then we had to start coordinating so we could return to work. My mother-in-law was there when we needed to be with our children, or our schedules overlapped. We stayed at the Ronald McDonald House of Marshfield, and thankfully we had extended family watching our 2 young daughters at home when we couldn't be there. After multiple rounds of chemotherapy, a bone marrow collection, an evaluation for experimental treatments, and other trials, Ashton died on April 18th, 2020. He was only 18 months old, Adams said, and he died in my arms. Although the Adams family had some difficult and traumatic experiences, the team at Marshfield Children's became like a second family. One individual who helped the Adams family, and in particular, was Dr. Rachel Young, a psychologist with Marshfield Clinic Health System. Ashton's death coincided with the rise of the COVID-19 pandemic, which prompted a relaxation of regulations related to insurance reimbursements and privacy issues for delivering services via telehealth. People who have never experienced the trauma of losing a child don't understand that something like that, it's extremely difficult just to get out of bed in the morning, Adam said. He also thinks males have a harder time going to counseling and asking for help in general. If I had to call Dr. Young to make an appointment, drive 90 minutes to get to her office, and then do an in-person session, I never would have done it. Many see the logistical advantages of telehealth, such as saving both patients and providers travel time and delivering better access to health care to rural populations. However, when it comes to mental health services in crisis situations, telehealth services can actually be a lifesaver. Dr. Young was there with me at the hospital, Adam said. She met my son. She was with us during the entire thing. She knows everything about me. I'm so thankful to be able to talk with her once a week over WebEx. I couldn't get through this trauma without her. It saved my life. Adams has personally seen so many advantages to telehealth services that he hopes regulatory and reimbursement rules will continue to allow people to receive similar services after the global pandemic ends. I can't see going back to the way it was, he said. Telehealth makes it so much easier to accept help. It takes all the different steps away. You don't have to make an appointment, travel, or waiting room worried that everyone is looking at you and thinking you are crazy. You're in the comfort and privacy of your own home. You can just click on a link and the doctor is right there. Adam believes in the greater access to telehealth services, particularly in crisis situations, is one of the positive things that has come out of the COVID-19 pandemic. It is a blessing to have the opportunity to connect with Dr. Young through WebEx regularly, he concluded. I thank her all the time. The availability of telehealth helped me drop my pride and accept the help I needed. When it comes to mental health, telehealth can save people's lives. We have hundreds and hundreds of stories like these, and some of them are very emotional. The way that telehealth has impacted people is more important than how many visits we've done, because telehealth has really made people more connected with their doctor at a time when we really couldn't be. And this is one example. So prior to the pandemic, we couldn't do this, and we couldn't do this because of regulatory reasons at the federal level. Those regulatory barriers came down very quickly when COVID passed. The CARES Act was passed, and in the CARES Act there was language that allowed the federal government, specifically Medicare, to adjust rules and issue waivers when a public health emergency is declared. And they did it very quickly. In fact, they announced what they were going to do once the law passed, which was on March 27th of 2020. They actually announced what the rules would be on March 13th, knowing that this is what we're going to have to do. We're going to have to ramp up telehealth quickly. Once the public health emergency ends, all of those waivers go away, and we go back immediately to the way it was before. How do we prevent that from happening? How do we keep the new normal? Which, by the way, side point, I really dislike that term. I think we've heard a lot of new terms that we're probably growing tired of, but the new normal is a good way to describe what telehealth is doing to healthcare. So if we think about new normals in healthcare, healthcare has gone through this before, right? George Washington on his deathbed had bloodletting performed on him to rid him of his pneumonia. It wasn't effective, right? Bloodletting is an ineffective treatment, and that was at a time when we had ineffective healthcare. Towards the end of the 1800s and into the 1900s, the profession of doctor became, a doctor's job became a professional job. And we started going to people's houses, getting in the horse and buggy and later the horseless carriage to deliver care right in your home. That worked well, but it was very inefficient. A provider, a doctor, couldn't see that many people in one day. So over the next 100 years, we created the amazing healthcare system we have today, where we go and sit in a waiting room with everybody else who's coughing and sick. And while this is much more efficient from a healthcare standpoint, that doctor can see 20 or 30 patients in a day instead of 5 or 6, it's incredibly inefficient for us, and is certainly inconvenient. And that leads us to the final slide, innovative. How can we go from ineffective to inefficient to inconvenient and finally land on something positive, innovation? How do we keep those three from coming back and more specifically losing the ability to do televisits? Well, there are three key things that need to happen over the next several months. The first is permanent federal legislation needs to occur. This is driven by the federal government. Congress needs to take action. What's most likely to happen, based on what we've heard in Washington, is that there will be a 2-year continuation of these flexibilities post-pandemic, meaning that there'll be legislation that says when the PHE ends, everything stays as is. 2 years, we'll have to address this issue again. The only concern I've heard from anyone in these conversations about the growth of telehealth is a lack of understanding of the impact it may have on chronic illnesses. If you start to develop virtual programs, do you exclude people from participating, and does that population of people see worse outcomes with their chronic illness? But that's it. There is strong, stark alignment across the spectrum, the political spectrum, for the continuation of telehealth, including a bipartisan bill by the Cheney-Dingell bill, which addresses most of these regulatory issues that we need to make sure stay in place. Beyond the federal government, I think everybody is aware broadband has been a big topic of conversation. I think a lot of us learned how much broadband we have or don't have over the last 2 years. And Marshfield Clinic has been very involved in broadband expansion efforts along with the state and at the federal level, and we'll talk about that a bit more as well. And then finally, technology's got advanced. I can't tell you how many brand new, still wrapped in the box iPads we saw that were 8 years old during the pandemic. Every one of you who gave grandma an iPad, she put it in her closet and she didn't take it out till last year. And we saw them all. But there are limits then on the technology and what you can do with it. Still more, as we do more virtual care, we need to leverage your iPhone or your tablet or whatever device you have. Bring your own device or BYOD. What can we do to get more data from you, to get more biometric information? We'll talk a little bit about that as well. First, on the legislative front, this is our executive director in the top left corner, Dr. Narayana Murali. He had the opportunity to address the U.S. Senate Finance Committee back in May, along with 4 other providers across the nation. All of those providers were in agreement. We need to maintain these flexibilities for telehealth after the pandemic, including telephone. Telephone is something we'd never gotten paid for before, and suddenly we were getting paid for doing telephone visits. But recognizing the lack of broadband, and I'll point out another slide, 60% of our telehealth visits over the last 2 years have been via phone. We can't not have phone be covered because it's going to disenfranchise so many people who don't have broadband. Broadband needs to be a focus, but until broadband is universally available, which will be quite some time, phone care has to be an option. An interesting, this was a 3-hour Finance Committee meeting. It's recorded. You can go watch it online if you'd like. I did watch it. The one quote that came out of here came from Senator Cornyn, Republican rather, from Texas. And this kind of underscores the stark alignment between both sides of the aisle. He said, there are only 2 good things to come out of the pandemic: telehealth and margaritas to go. And we need to keep both, he said. And I agree on both. Broadband is a bigger issue, right? Broadband is something that if you live in an urban area like Madison or Milwaukee or even La Crosse or even Marshfield for that matter, you've got good access to broadband. But if you live a mile out of some of these towns, you don't have much. We have a number of locations that can't get any internet service. And so a new type of internet service, Starlink, is something that we are involved in piloting over in Eau Claire County. We joined forces with Eau Claire County, who is going to run this project, and we actually did something you don't see a lot of. Marshfield Clinic partnered with Hospital Sisters Health System and Mayo Clinic Health System to jointly run this pilot in Eau Claire County. We're providing internet access to 50 homes for 12 months, covering the equipment and the monthly service fees in return for them telling us what they think and giving us feedback. And that just kicked off. We had our first surveys come in actually last week. So we're looking to learn more about the resiliency of that service, the customer service, whether it's something we can recommend to our patients. I should point out that it's an amazing technology. It's not cost effective. It's $100 a month. And for those of us working, and that's probably a reasonable amount to pay for internet access. But if you're on Medicare and a fixed income living in Ladysmith, Wisconsin, $100 a month is not something you can afford. So when we talk about broadband, we always have to talk about the context of access and affordability. We've continued Marshfield Clinic to support community broadband expansion efforts. The Public Service Commission of Wisconsin has a grant program. We've written letters of support for a number of years for those. Prior to January 2020, we had written a total of 21 letters. And I'm sorry, that should be 21. January of 2021, we had written a total of 21 letters of support. I wrote 28 letters of support just last month for the most recent round. Broadband expansion is happening quickly. Oops, sorry. And then finally, investment with the Public Service Commission and legislature on expanding broadband. Money is one piece of the puzzle, but we have to have a plan for how we spend that money on broadband expansion as well. I was able to serve on the Governor's Broadband Task Force as a representative of healthcare. That task force met from late last summer through this past June when our final report was submitted to the legislature. You can Google that and read it online. I'm going to talk about a few of the high-level things in that. First and foremost, Wisconsin has a goal of having 100% of our residents covered by 25 meg by 3 meg service by 2025. That was something the governor had already committed to, and so we started there. One of the things that's always been a problem for broadband is moving goalposts. So if the goal to have broadband today is 25 by 3 meg, we know that's not going to be true in 20 years. And internet service providers have to deploy technologies that meet certain standards in order to receive certain funds. When the goals move, suddenly we say now we're going to make it 25 by 10 meg. Suddenly overnight, all of the stuff they've deployed is no longer considered broadband. So we thought it was important to have some markers out in front of us. We want to get to 25 by 3 by 2025, but we want to get to 50 by 10 and 100 by 50 by 2031. And the purpose of this is, of course, to let internet service providers know where we are going. We also had some higher performance goals. Those are great internet service speeds today, but if you're a business, that's not going to be sufficient. So we also want to make sure 50% of our properties in the state of Wisconsin have access to 1 gigabit service by 2025, and 90 have that access by 2030. Is this realistic? Probably not, in all honesty, but it's good to have aggressive goals. I do think this could be achieved, but it's going to require a lot of effort. We'll talk about that. So has anybody ever looked at a broadband map to figure out what kind of internet service you might have at your house? Has anybody found it remotely useful? These maps are outdated. They're not updated frequently enough. There's a lot of proprietary information that's not on these maps. And most importantly, when we say this block of area has internet access, the requirement is that one home in that 1 mile census block has internet access. So if your neighbor down in the corner 3/4 of a mile away has internet, then we assume you do as well, and we know that's just not how it works. We need these maps updated. We need to have these be actual usable tools for both consumers and internet service providers. That's one recommendation. Consumer transparency. One of the things that's frustrating to me, when I get my gas bill from Wisconsin Energy, I can see exactly how many therms of energy I used and how that compared to what I used last year. When I get my broadband bill, I just owe somebody $75, right? No explanation. You had service, pay us now. This and nutritional facts is intended to be something that could be used on a bill to help people better understand what they're getting. What service level are you paying for? What has your performance been? Have there been outages? Starlink, for example, on the app that you get as a consumer, it'll tell you every second that it's down, and it logs it. We were down for 2 seconds. You lost internet access. We need that type of transparency for all of our consumers. Specifically in how it's performing. Latency, that's the delay that you get, the lag. If you have teenagers, they'll refer to latency as lag when they're video gaming. And peak bandwidth limitations. I like asking this question because I don't know the answer to it either. Do you know how much broadband you're using? Nobody knows how much broadband they're using. They forget about all the other devices they have beyond their phone or computer that are using internet service. So we need to understand how much of that 25 meg or 10 meg or 100 meg pipe you're using so the consumers know when it's time to upgrade. Or, likewise, scale back because they don't need the service anymore. Money, right? We need money. We know that. In 2019 to 2021, the governor's biennial budget had about $24.5 million that was allocated for the Public Service Commission to allocate grants to communities who want to do broadband expansion. In 2020, the round last year with $24.5 million, we had about $68 million in requests, so about 3 to 1. We had a special round of funding this summer from the Federal Communications Commission that was made possible through the CARES Act. That was just, the applications were due July 27th, and I had no doubt we would see $100 million in requests. I wasn't sure how much because we had $68 million the last round. I think it was $49 million the round before that. With $100 million, I thought we'll probably be able to fund just about everything that gets requested. We had $438 million in requests from Wisconsin communities for broadband expansion grants. It's $500 million of projects that are ready to move forward if they're funded. There's a significant need for broadband. Another indication of the strong support between Republicans and Democrats. Governor Evers had asked for $202 million for broadband expansion over the next 2 years, with $152 million of that being dedicated to broadband expansion. That's roughly $75 million per year, up from the 25 roughly we're spending now. The legislature, Republican-controlled, disagreed with the Democratic governor, but they just disagreed that, yeah, we need to spend a lot more money, but they adjusted the number a little bit. They reduced it down to 125, which is still 2.5 times what was funded in the last budget. This again underscores that whether you're Republican, Democrat, or in the middle, or have your head stuck in the ground on either end of that bookshelf, broadband is something we all agree on needing to be expanded. This is the cool stuff, the technology, because when we do a video visit, and let me just quick show of hands, who's had a telehealth visit in the last few? Wow, that's fantastic. When we do a telehealth visit on your iPhone, this is what we see, right? We can see you. And that's much better than a phone call because we can see you don't look stressed, you're not sweating, you're not pale, your eyes aren't bloodshot, you look okay. And that tells us something. But we can't listen to your heart, we can't determine what your heart rate is or your respirations or your blood pressure. And for a lot of patients, that's a critical metric we need to have. And so they have to come into the office and can't do a video visit from home. Remember, in a rural area, that means they might have to drive an hour, hour and a half to come into the office. So what if we could use artificial intelligence? And this is a company, Bina AI, that's going through FDA approval right now. And we'll be able to use technology, artificial intelligence, to actually calculate by looking at the reflection of light in your cheekbone. And every photo, because remember, a video is nothing more than about 30 photos per second streamed together. And it looks at that light change in your cheek and can determine a number of metrics. In this case, it will tell us what your heart rate is, your blood pressure, mental stress, oxygen saturation, respiration rate, and heart rate variation. And interestingly, they're working on alcohol blood content, which I would have really enjoyed in some of the Zoom meetings I've been in over the last 2 years. So I have to assume there were a few meetings where they weren't all zeros, right? But this type of technology now, I can see you, I can talk to you, but now I can get some vital information. And again, this is going through FDA approval. It needs to be clinically accurate before it can be used. But this is the type of innovation technology that you'll likely see over the next few years, whether you're going to UW or SSM or Marshfield Clinic Health System for your care. Incidentally, a provider would have to ask your permission to do this, so you don't have to worry about having a late afternoon cocktail before your doctor's visit. They would have to ask permission, and you would have to give an okay to have those vitals collected on your phone before they do that. This is something we're probably all very aware of. We've been wearing wearables for years. We all know how many steps we take and how many minutes we do or don't sleep at night, but your doctor doesn't care about that. How many of you have ever had your doctor look at that? Probably not many, right? Patient-generated health data is a big thing. It's lots and lots of data, and healthcare systems have to determine what can we rely on, what do we need, what are we doing with it, and how do we store it? That's something we have to figure out because patient-generated health data is going to become more and more central to how we deliver care. So wearables and integrating those into your healthcare, as well as consumer devices. The device you see there is a TitleCare device. This is a direct-to-consumer device you can buy online or from Best Buy. And if your health system uses this device, it allows you to do more in a video visit. It's got an otoscope attachment, so your child, rather than having to go into urgent care for their ear infection, can sit on your lap on the couch and you can put an otoscope in their ear and the nurse can see that inner ear from wherever they're treating you from, and hopefully reduce the need to go into the office. Again, that technology, though, you have to have in order to use it. We do want to do as much as we can with AI because that uses the technology you already have in your hand or pocket. One of the things I always want to make sure people understand is what's in it for me meaning the patient. First of all, you get easier access to your primary care doctor. You can do video visits on your mobile device. Easier access and increased quality outcome for chronic patients. The best thing we can do for a chronic patient is be accessible to them, to be able to respond to them quickly to solve whatever issues they're having. Remote patient adjusting care plans on the fly via the phone is one way we can help keep chronic patients healthy. Of course, reducing access costs. Healthcare is expensive, but it's not just the bill from the doctor for the day. Lose money. They might need childcare, or they might need somebody to pick up their kids after school. And of course, the outcomes we have for our patients, and that's possible when they can stay compliant with their care plans, come to their follow-up visits as they're supposed to, complete their education as they're supposed to. And again, telehealth can help make that more possible. I'll end with this quote. The future is already here, it's just not evenly distributed. Unfortunately, I've had this hanging on my wall for like 10 years, and it's still hanging there because the technology is still not available to the masses as it should be, but that's what we view as our job in telehealth. And with that, I would be happy to take some questions. I ran out of time for questions, didn't I? That's what happens when you ask a politician to talk. So one of the recommendations you'll find in the Governor's Broadband Task Force is a dig once policy, as well as some communication items that need to happen. Right now, if a community wants to run a fiber optic cable through town, they have to notify all the carriers in town that they're opening the ground and pulling a cable. If a carrier is opening the ground, they don't have to let anybody know. And so there's no communication to say, hey, we're running fiber by this house, we also need to run fiber, or we need to run copper connections. That's an all too common occurrence, and it's one of the things the governor's broadband task force did address. But that will take legislative action from the state legislature to put new rules in place. But you're right, we see that all the time. People literally are, I can spit on the fiber optic cable in front of my house, but I can't connect to it. It happens all the time. Yeah, it's frustrating. Other questions? Thank you, everyone.
Thank you, Chris, for your presentation. We are adjourned.